Good morning, everybody. Dr. Wendy Fortna here with your update for the community and surrounding areas of Hanna. Today is Wednesday, May 13th. So right now we have 0 active cases in our community, which means no one in our postal code has a COVID positive. Our 1 case has resolved, meaning they are no longer symptomatic. We have no cases in our hospital, no cases in our nursing home, no cases in our lodge. All of our physicians are healthy and seeing patients right now. So lately we've been hearing lots and lots about the modeling and what's been happening, and I am very excited about the fact that the things like social distancing that we have put into effect have been wonderful, and we have way fewer cases than we thought we would have at this time. So it worked, what we've been doing. And now we have both the exciting and slightly scary idea that things are going to start to reopen. And I think people are generally split. I am both of those things. I'm really excited to get my hair cut, hopefully, but I'm also nervous about what it's going to mean for my family and for the health system as to whether there's going to be new cases once we start to open up more services and we get out camping. So a reminder to everyone that the importance of staying 2 meters away from other people is still there unless they're part of your cohort family or immediate family as well. So that's important for you. You may have heard that surgery that is non-urgent, things like hip replacements, cataracts, they are now open again. You will find out if you are referred for one of those procedures from your surgeon's office or the hospital performing your procedure, whether or not yours is going through at this time. So unfortunately, I don't have information about whether or not you're going to get that knee replacement right now. You should wait for phone calls from your surgeon's office about that. Similarly, people who are having things like outpatient cardiology or neurology appointments, you will hear directly from those offices. The process right now is that your family doctor sends referral letters, and the receiving physician, for example, the cardiologist, will review that case and decide whether or not you need to be seen in person, if physical exam is a very important part of that visit, or if you can have a virtual visit through phone or perhaps through a face-to-face video. So you will still potentially have a visit that's not in person, but you will find out at the time of the appointment booking whether or not that is the case. You guys have been doing a wonderful job of booking appointments for lab and x-ray. We are still required to do those things. Here in the family doctor office, we are offering driver's medicals now, but we have not started offering routine medicals yet. When that does happen, we will let you know and you can start booking those procedures. If you're not sure whether or not your particular concern needs a visit, certainly contact the medical clinic, talk to the nurses, talk to the receptionist, and they'll help you know whether or not it's time to book that visit that you are looking forward to. I've been asked kind of a difficult question this week regarding the tracing app, the one that you can download to your phone that can determine when you are out and about whether or not you come in close contact with someone who ends up being COVID positive. I have to defer this one a little bit because my expertise, while medical, is absolutely not technological. When I've looked at the app, I think it in theory would be a wonderful way of making sure that if we run into random strangers at the gas station and maybe got close to them, that we would know if we were exposed. But there are some difficulties with knowing to turn it on every time you leave the house and whether that's going to drain your battery. So I have mixed feelings on it. I'd have to tell you to go to the Alberta Health website to learn more about that and form your own opinions. I also have been asked to talk a little bit about some of the misinformation that's out there. Unfortunately, there are some people taking advantage of the COVID situation, and they're trying to target seniors or people who may not be as up to date about what's happening. Things like phone calls telling people that they have been in contact with COVID and please send information so that we can track them more. Know that if that's happening, you will be very clearly identified as Alberta Health employees, and they will never ask you to send money or personal information to them. If you're getting something like that, contact your local RCMP, or you can phone the medical clinic if anyone tells you they're calling from here, just to make sure it's the right people behind the phone call. I think that's all I have for now, so thank you very much for your continued vigilance, and we'll see you next week.